Thank you very much for having me. And I really appreciate the opportunity to be able to share my passion, and which is lifestyle medicine and how it relates to heart disease. And one of the things I ended up doing more recently is getting board certified in lifestyle medicine as well. And so I'll talk a lot about my journey and how all that relates to heart disease and what we're going to go through here today. So I'm sharing my screen here. All right, there we go. So yeah, I again appreciate this opportunity. It's kind of an amazing adventure that I've been through in my life, which has brought me here today, spreading the power of lifestyle medicine, plant-based nutrition, and everything in regards to how it affects heart and cardiovascular disease. So I'll share that whole story, some of the things I've learned along my journey, some crazy things that's happened to me in my life that really has emphasized all these important concepts. I do need to start by making a slight apology for two reasons. Number one, I am on call right now. There may be a possibility I'll have to check my phone and message back and forth. And you may hear some construction noise because I am here at the hospital right now, and they have a bunch of construction projects going on. Hopefully those interruptions will be minimal and we can focus on what's important, which is learning about lifestyle medicine and heart disease. And I do think this picture is the perfect way to think about lifestyle medicine and heart disease. You have two different roads you can go. The typical American takes the road on the right there where it's just pills and procedures. But on the left is lifestyle changes with a predominantly or exclusively plant-based diet, exercise, and lots of other things. And honestly, as we all know, the most powerful thing to do for any medical illness is to treat the cause of the problem. It's just common sense. Unfortunately, that's just not the way our healthcare system is set up at this point in time. So in order to really get into this and talk about it, I'd like to start a little bit with my personal journey and how things have gone for me. This was me back in 2014, almost 100 pounds heavier. I was following the standard American diet and starting to suffer from a lot of standard American diseases, of course, not just obesity, but sleep apnea, high blood pressure, high cholesterol. I had a lot of palpitations. I had back pain issues and horrible acid reflux. And it was really, I had an aha moment when I was walking up a flight of stairs one day and I couldn't breathe and my heart was pounding. And I said, geez, I got to do something about this. I'm only 34 years old. I have 6 kids and I need to really be around for them. And at the same time, I was getting frustrated because this was my medical practice. Pill, 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 pill. It's pretty much all I did was prescribe medications, order tests, and tell people when they needed heart surgery. And I realized quickly people didn't like the pills. They had side effects. They cost money. And ultimately, even if I gave my patients all the proper medications as dictated in the guidelines from the American Heart Association and the American College of Cardiology, all the right medicines still wouldn't necessarily prevent a heart attack or a stroke or their heart disease from progressing. So I was like, I knew something was missing, but I didn't quite pinpoint it until my own personal health issues came full blown right at me. And it coincided perfectly with my frustrations as a physician, a practicing cardiologist, seeing how people didn't like the medications, how they didn't work all that great. So I said, all right, I'm going to get my life in order. I'm going to really take control of things. And then I realized I had no clue what to do. I wasn't trained in this, right? Doctors don't learn nutrition. Our idea of prevention in the medical world is pills, right? Giving cholesterol meds, blood pressure meds, diabetes meds, aspirin. Our concept of prevention in our world, when I was trained, was medications, not eating healthy, exercising, losing weight. So I made a ton of mistakes, which I share a lot with my patients. Number one, thinking exercise was the key. Exercise is not the key. It's maybe 20% of being healthy, 80% is the food. And I'll tell you some crazy stories about that coming up. The other misconception is thinking chicken and fish were good for me and eating low-fat dairy products and putting olive oil all over everything. And this is kind of what a more Mediterranean style diet can be like sometimes, what the USDA dietary guidelines recommend. And I made the mistake of reading that document thinking the government's not going to lie to me, right? Government's got to be telling me the truth. But you know what? It's a lot of industry influence on there. And so that's another mistake that I made that I really try. And then, I still ate unhealthy foods in moderation. Of course, I didn't want to give up the burgers, the fries, the ice cream. I just cut back. And I soon learned things that are bad for you shouldn't be done in moderation, right? You shouldn't smoke cigarettes in moderation. You shouldn't do heroin and cocaine in moderation. Things that are bad for you should be zero. But just like cigarettes, heroin, and cocaine, this stuff here, the standard American diet, is very addictive. It's like a drug. Sugar is like a drug. It's not just easy to snap your fingers and give it all up. So it is a challenge. But what really hit me was when I watched Forks Over Knives, the documentary talking about plant-based diets and their power to prevent and reverse heart disease. And I thought it was propaganda. I thought, no way, it's real. This can't be legit. I was actually angry. I remember almost yelling and screaming out loud, thinking, why didn't I not know this when I first learned about plant-based diets? Because I thought you had to eat meat to live and such. And I when I researched it on my own and I looked at all the medical literature, reviewed things, and it's legitimate that really at least 80%, and most expert thinks around 90% of heart disease is preventable through the proper lifestyle. And I was thinking, why the heck was I not trained in this? This should be the main thing I'm focused on. This should be all my training, not just pills, surgeries, and procedures, but that's just not the way our medical system works. So I ended up taking, my own health into my own hands, changing my diet to a whole food plant-based diet that was low in fat, and exercised. And I continued with the exercise, ran some marathons, lost 100 pounds. And man, I tell you, it changed my life quite a bit. And now my passion is just so strong to share the power of lifestyle medicine and try to be part of the change in regards to our healthcare system and the way we approach these things. And the change is coming. It's just a very slow change, like everything in our world, unfortunately. And I want to do everything I can to get it to speed up. Everybody's hoping, oh, let's just wait for artificial intelligence to solve all of our medical problems, right? That's not really a great idea. We have the solution now. We just need to be able to enact the change our culture, our food system, healthcare system, and government policies. And we'll talk about that. So what we'll do here today is we'll talk about the current state of healthcare in the United States briefly, which, as you may know, is not very great. We'll do a little quick crash course on nutrition. We'll talk about prevention and reversal of heart disease and our whole lifestyle medicine concepts about how we make sure that you don't have a heart attack and you don't clog your arteries up with plaque, and then things that you can do to kind of top it all off. And along this way, I'll share some stories and some crazy, interesting things to kind of make it more memorable and really kind of drive the points in that we need to learn and take out of this today.